NHS Salford Clinical Commissioning Group is the organisation that buys health and care services for Salford. To do this effectively, we involve citizens and the public in decision making. Between April 2018 and March 2019, we involved over 6,000 citizens. We talked to people about a wide range of topics to get their views. These are some of the things we spoke about: mental health, suicide prevention, wellbeing space at RHS Bridgewater, dermatology, healthy eating, cancer, social care services, care navigation, urgent care teams, dementia, supported tenancies, safeguarding adults, special education needs, over-the-counter medicines, autism, learning disabilities, digital health, poverty, innovations, carers' needs, and the NHS long-term plan. There are lots of ways we involve people, and we can provide support for you to become involved too. We have specialist engagement workers to help with this. NHS Salford Citizen Panel is made up of over 2,400 members of the public and local health and care staff, including the voluntary sector. Feeding into this are many forums where people with a specific interest come together to help shape services. For example, the Listening to People group is a group for people with learning disabilities and their families and carers. The Dementia Champions group is a group for people living with dementia and their families and carers. And we also work with partners to support Salford's Mental Health Forum. People who come to these groups are actively involved in shaping services for the future.
Well, I became part of the Champions group because my wife has Alzheimer's, and we basically want to learn as much as we can about the disease, about what's going on. Coming here, every meeting, talking a lot, discussing various things, from power of attorney to caring to whatever, care homes, etc. We can actually influence the people who make the decisions.
I'm Dr. Joy Watson, and I've been coming to Champions Group for, trying to remember how many years, probably 5 now. I was diagnosed with dementia at the age of 55. As so many people with dementia have lost their voice or haven't got a voice, but coming to this group gives me a voice, and I can also listen to other people's views, ideas, so that we can bring about change, not just in Salford but in Greater Manchester. It's really important to me.
So originally I started coming along to the group because I got voted in as the Service Use and Care Governor for Greater Manchester Mental Health. I do think it's quite important for when discussing mental health policy for service users to actually have a voice in what's said about them, and we have a great saying which I think is used nationally is nothing about us without us.
I came to the group as a representative from Health Watch Salford. I just think it's important that we have to raise more awareness on mental health, especially in children and adolescents.
Anyway, I'm trying to one of the efforts. I really enjoyed it and that, and the other groups I'm on, like co-chairing, helping people with learning teeth, how to understand how support people in a way. People have an experience of being a chance of being of a voice being heard.
People tell us that the most important thing about being involved is that we listen to their views and we make changes where we can. We also feed back to those involved about how their views have made a difference. Here is one example. We worked with RHS Bridgewater and people with profound physical and learning disabilities to help design the therapeutic garden. Service users told us they wanted accessible facilities, shaded areas and lots of interactive tools. The designer has used their views to design a fully accessible space, and there'll be a changing places toilet, the first in Salford. Sometimes what you tell us helps us to decide we are travelling on the right path and that things don't need to change. and sometimes we pass your views on to providers such as hospitals and community services and include things in their contracts, or we start a new project and sometimes we make changes to our plans. You can read our full annual engagement report or find out how to get involved by visiting the following link: www.salfordccg.nhs.uk.